So this is another one for hip replacement, or especially anterior hip replacement, where it's a little more stable in the hip and we can do a little bit of flexion. Again, we're going to want to go very slow, cautious with this, not overloading. All the same principles apply. So when you're trying to flex or do anything, you want to keep your hips back, your chest forward, not so much of it folding in half, but just to stabilize and you be able to use your core for control. So one thing that a lot of people have trouble with after a hip replacement is getting their socks and shoes on and off. And again, this is not something you're going to want to try to get done, within the first few weeks, certainly after your surgery. It's going to be more like a month down the road. But over time, gradually working in that direction. So just make sure that you're in communication with the PT that you're working with and your surgeon about what's appropriate and when it's appropriate. So getting that sock shoe, so lifting and twisting like this is usually pretty challenging because it's an open chain, it's less stable. So there's also challenges involved with bending forward, although this is a more stable and controlled position because not only do you get to stabilize your hip more, you can use your back muscles and your core to control your body weight as you're coming in and out. So something that can be worked on for that is, without even bending forward, is something where you're actually working your upper body more, working those muscles, and maybe letting the band pull you more forward. Again, kind of this eccentric, concentric pulling back and extending versus coming forward. Or if I had the bands a little lower too, I could be pulling more up and back and letting it pull me down forward. But again, always controlling, being mindful of how far you're going into your bend here, trying not to overdo it there. Okay, so if I want to do this, I could do not like that with my hip, but I could do it with weights too, to kind of control the weight against gravity here. And then also thinking if you're going towards that leg, again, very cautious, be able to control from your whole body around that hip as you ground your hip into the floor and stabilize it so it's stable and not flopping or just getting pulled and cranked on. That's something you definitely don't want to do. Another option, which I of course have it set up for the opposite leg, I think so, is to, for this leg. So if I'm using, say, my left, now again, getting this on and off is going to be a bit of a challenge probably. But if I want to look at something more like the rotational part, I want to be very gentle here, and I can do just a little light one here. I'm not going for full range. But this can also give me a little bit of stability as I'm working through here. And very much after a month for this, something like this, maybe even longer, maybe 6 weeks, just to be safe. But this, I switched my left though, but it's the same idea, right? That's coming up and across, almost think of like hacky sack there, okay? But some combination of these things, being able to work it gently with some feedback and resistance to get those muscles to release a little more in the back and the hip. Okay, good.